End of April.
How this outbreak unfolds is in the hands of the public.
Thousands of deaths, the province lays out a chilling forecast for what may be in the COVID-19 outbreak and what we can do to make sure the worst doesn't happen. The numbers are projections, and officials caution today that they are inexact. Nonetheless, they are alarming, but they also illustrate that the changes we've made in our everyday lives, such as physical distancing, closing schools and workplaces, appear to be making a difference. The number of dead over the course of the pandemic is projected to be between 3,000 and 15,000. The models also show Ontario could see 1,600 deaths this month. Farah Morelli joins us live tonight from Hospital Row to break this all down. And Farah, a lot of unsettling numbers, but one point that was made over and over again, what happens next is really up to us.
It really is, Dwight. So much of what we do and don't do when it comes to physical distancing will impact these numbers. Now, health officials emphasized today that these figures are projections, numbers that are fluid and can be changed based on what we are doing. They said they are releasing these numbers in hopes that people who aren't yet taking this seriously realize that they can change the outcome.
Over 1,600 people could be dead by the end of April. That's 50 a day, or that's 2 people every hour.
It's a grim and sobering projection released today by Ontario health officials.
Each one could be your brother, your sister, your mother, your father, your grandparents, or a friend.
Their message, a clear one. Thousands of lives can be saved if more action is taken to halt the spread of COVID-19 in Ontario.
We are following a trajectory somewhat similar to that in the United States.
Here's what the models are predicting. If the government continues its actions now with social distancing measures, they predict there will be between 3,000 and 15,000 deaths in Ontario over the course of the pandemic. What's more disturbing are the predictions about what would happen if nothing was done over the same period. Without any actions by public health officials, they project 100,000 people could have died.
I appreciate that to many people, these will be shocking figures. But the important thing to stress again is that effective actions have been put in place.
Health officials cautioned projections are inexact and numbers could change if more is done.
We all have to ask ourselves, what is the cost of a life? Is a life worth a picnic in a park?
Today, Premier Doug Ford announced more businesses will be forced to close, including non-essential construction.
We have seen the numbers.
The federal government hasn't released its own projections, but says those are coming.
As much as we can do at the federal level, as much as we can support, as much as we can bring in quarantines and decrees, ultimately, it is Canadians' own behavior that will make the difference in this. How we get through this depends on you.
With warm temperatures in the forecast for Ontario this weekend, it's that message that public health officials hope people will heed in the days ahead.
Now, Dwight, one of the interesting things to come out of the press conference with health officials today was that they're doing this modeling and these predictions on a period of 18 months to 2 years. And that means that we could be seeing or dealing with the effects of COVID-19 for up to that long. They did say they don't expect these restrictions on physical distancing to continue that long, but they were very clear that we are a way off from lifting any of those restrictions right now. Dwight.
Farah Morelli on Hospital Row tonight. Thank you, Farah. And in an effort to keep those numbers from climbing higher, the province added more measures today to prevent the spread of COVID-19, including limiting construction projects in the province. Angelina King has the details.
Toronto is about to get even more quiet. As of tomorrow at 11:59 p.m., some construction sites will be shut down. The Premier saying the decision wasn't made lightly, but says people's lives are more important.
We've had to do the unthinkable. In the span of 2 weeks, we've been forced to close the vast majority of workplaces in Ontario. We've had to shut down most of our economy.
Some construction sites will stay open. Critical work at refineries and petrochemical plants can go ahead, as well as infrastructure projects like hospitals, roads, and bridges. While no new residential construction will be allowed to start, current residential projects that are almost complete are allowed to finish. That includes condos. The Residential Construction Council of Ontario welcomes the move.
We're pleased that the government made the decision to enable us to complete houses for home buyers who might otherwise be left in the lurch.
Those few sites that will remain open will be placed under the highest level of scrutiny possible.
But some don't think it's going far enough, including one contractor and project manager. Antonio Cruz shut down one of his sites 2 weeks ago. He doesn't think residential construction should be deemed essential.
The possibility of spread is still there, right? So honestly, I mean, it's like we're taking little steps at a time as the numbers grow.
This comes as the province updated its list of essential businesses. Cannabis stores will now be closing, but the LCBO and beer store will stay open. Other businesses must close or move to curbside pickup and delivery. That includes stores that sell hardware products, vehicle parts, pet supplies, and more. And on Wednesday, there'll be reduced service to GO trains and buses, just another measure to help stop the spread. Angelina King, CBC News, Toronto.
Angelina reporting from home tonight. A critical part of today's projections, what the numbers mean for our hospital ICUs. Ontario is building capacity for hundreds of more ICU beds, but as Lisa Shing reports, the projections show the system won't be able to handle a major spike in cases.
It'll push beyond the capacity that we can bring.
The head of Ontario Health painting a stark picture of what a surge in COVID-19 patients could look like for a resource that's critical for the sickest patients.
If we can keep the prevalence of the disease to a lower level, the capacity that we have online or that we could bring online would indeed be sufficient.
That capacity he's talking about is critical care beds. There are about 2,000 in the province. Right now, Ontario has roughly 400 ICU beds available for COVID-19 patients. Officials say we can expand that by 900 beds. That expansion will only be enough in the best case scenario. In the worst case scenario, there will be far more patients than critical care units can handle. Meanwhile, the number of patients in Ontario's ICUs has grown to 197, up by about 30 from the previous day. Now, if we look at the Toronto area, CBC News has obtained exclusive data that shows the Central Local Health Network, which includes South Lake, Markham Stouffville, as well as North York General, only have 9 available ICU beds between them. The president of North York General says it's already adding extra capacity.
It's really hard. It's hard to see those numbers. So it's identifying what parts of our hospitals we can add ventilators in, where are those ventilators, what are the key parts of ventilators that we might need.
The health minister says different hospitals will be planning for more patients in different ways.
For some of them, it may mean renting space in hotels or motels. Some of them are using space in retirement homes, and some of them are actually creating field hospitals.
The chief of medicine and an ICU doctor at Markham Stouffville Hospital says it's not about creating capacity for patients that worries him.
We're going to be most limited by the staff that can take care of those patients. People are going to be working much harder than they normally do, and we're going to be working in a different way than we normally do.
The province says it's also recruiting more volunteers and retired nurses to alleviate some of that workload. Lisa Shing, CBC News, Toronto.
Our Queen's Park reporter Mike Crawley joins us live now with analysis on the release of these numbers today. And Mike, what stands out for you from the messages we heard from the Premier and these health officials today?
Well, Dwight, the Premier said he took these new actions to cut down on the list of essential businesses immediately after he saw this new data. There are questions about what took so long to get that new data to the Premier. And one of the questions is about Ontario's testing capacity for COVID-19. There were delays in test results coming. Even though Ontario was testing at a far lower rate than other provinces, we had a backlog last week of 11,000 tests that had not been processed. And so the delays in that testing meant delays in seeing what was going on with the spread of COVID-19 in that province And that meant delays in getting that data to the epidemiologists, the scientists who are studying the spread of the virus. And that meant that information didn't get into the Premier's hands until now. So I think that's a key question that remains unanswered.
Yeah, and we've heard from the beginning that testing gives you a clearer picture of what's going on. So what do you think is important then, Mike, in the modeling that was released today?
Yeah, well, the death numbers are really stark, Dwight, and obviously that's going to grab a lot of attention. But what you just heard there in the report from Lisa Shing about the intensive care numbers, that's really important. I want to throw up a slide here to take a closer look at Ontario's projected needs for intensive care beds. And having enough intensive care beds, this is really the most important thing for the health system, the hospital system, to keep its head above water in this pandemic. The projection here says that Ontario would need to add 900 ICU beds in the next couple of weeks to have enough. And that's in the best case scenario of the spread of COVID-19. So the questions are, how realistic is it to get that many beds ready in time? And how are the hospitals going to staff them? I put those questions to the Health Minister, Christine Elliott.
We have set up a website where people can volunteer to help. We've received over 10,000 applications already from people who are ready to staff these units.
But as you heard in the piece from Lisa, that ICU doctor is concerned about staffing. So it's not just a question that journalists are asking, it's a question that medical staff are asking about as well. Dwight?
Yeah, it really is. Thank you, Mike. Thousands of healthcare workers across the province are now grappling with these new numbers. It is heightening their concerns over staffing levels, as Mike just told us, and having enough personal protective equipment. Lauren Pelly spoke with some of those workers today.
The numbers are truly scary.
Brad Bowie has been a paramedic for nearly 3 decades, but his team has never experienced anything like COVID-19.
What we know about the disease changes from minute to minute, from hour to hour, from day to day. They're anxious because they have the possibility of getting themselves or taking it home to their family.
And it's not just paramedics who are concerned about the future. More than 800,000 healthcare workers, from physicians to nurses to respiratory therapists, are working all across the province. Many are in emergency departments, and clinicians say people with severe breathing issues are showing up every day and often need intensive care.
There's a war being fought out there, and there's a catastrophe that's ongoing, and unfortunately most people just are not seeing it.
This Toronto emergency physician warns this months-long battle could stretch hospitals beyond their capacity.
So when we talk about the Greater Toronto Area only having several hundred ventilators, and if we have hundreds of thousands of people potentially that need them, what that means is if you are one of those people that is critically ill and you need a ventilator and there are no ventilators, that's dead. That's a fatal outcome. There is no way that we can save you if we don't have a ventilator for you.
A nursing organization is also ringing alarms about equipment shortages.
We need a mask for every single worker in the system, and we need to open those much simpler factories than doing N95 and doing ventilators. These are very simple. They need to be done fast.
Both the province and federal government have promised more supplies are coming, but Bowie says what matters most is how we all handle the crisis.
I don't think we've ever seen something like this in the province of Ontario, in Peel, where everybody can help save lives.
Lauren Pelly, CBC News, Toronto.
The City of Toronto has 812 confirmed cases of COVID-19 with 42 patients in the ICU. Now, while the majority of the city is shut down to try and stop the spread of the virus, it is costing Toronto millions of dollars a week.
We're experiencing a financial pressure estimated at $65 million each and every week that this crisis goes on. This pressure is driven by things like reduced TTC revenues. Obviously, the TTC is not getting revenues for people who aren't riding on the transit system. And there are other decreased revenues as well, coupled with what you'd expect, some increased cost to make sure we support and look after people who need support.
The city is losing revenue due to closures, decreased demands, and property tax and utility payment deferrals. The city is also spending more money for COVID-19 related needs like cleaning and additional shelter space. Mayor Tory has assembled a COVID-19 financial impact group to focus on stabilization and rebuilding and is looking to work with both the provincial and federal government on different relief programs. 4 more people have died at the Pinecrest Nursing Home in Bobcaygeon. That brings the death toll at the facility to 20 residents. Only 65 called Pinecrest home. A woman who volunteered there also died. It is still unclear how the outbreak at Pinecrest began. Southwestern Ontario also continues to deal with outbreaks at long-term care facilities. Windsor host Chris Ensing joins us now. Chris, what is the update from your region?
Yeah, Dwight, we just got some new details on those long-term care facilities in our region. 2 residents have died at long-term care facility in Windsor, a man and a woman, both in their 80s. The health unit telling us that they both lived at Country Village Homes. Now, we do know that they were both tested for COVID-19. The positive results came in after they died. 3 more residents at that home are now COVID-19 positive. Here's a look at what people are dealing with here when it comes to long-term care homes in southwestern Ontario. 3 outbreaks at facilities here in Windsor, Essex. Amica and Lifestyles on Riverside are the other 2. There are 4 facilities in the London area that are dealing with outbreaks. And just a reminder, all it takes is 1 positive test in a staff member or resident to be considered an outbreak. And in Sarnia, Landmark Villages is currently dealing with an outbreak. 4 people have died of COVID-19 in that facility. All of this as the modeling projections start to be released. We had our local health unit release them this morning based on the best available data that they had. And again, these are projections. If we stopped physical distancing and returned to normal, we'd see close to 200,000 cases in Windsor, Essex, and 4,000 deaths over the course of the outbreak. But if we follow the strict guidelines, according to the health unit, we'd chop those numbers down by about 95%, saving thousands of lives, says our Chief Medical Officer of Health, if we remain vigilant. It could take 52 days to flatten the curve enough where we don't overwhelm hospitals. Now, all of this happening as the St. Clair College Sportsplex is being converted into a field hospital. There's 100 beds for low acuity patients, so that could include people recovering from COVID-19. Now, this is them setting up the facility. You can see beds that are being placed there as well. I just spoke with the head of Windsor Regional Hospital. He said we're entering the storm, that the next 2 weeks will be pivotal. A temporary morgue is being set up. And they're already seeing, he said, very sick patients in their 40s and 50s at the hospital. This dire warning that we continue to hear in Windsor, Essex comes as we get calls to our office about people who are not self-isolating. We heard from one man today who was at a local grocery store and was upset that he found somebody who had recently traveled back from the United States and decided to shop at Windsor before going to their next destination. Wayne DeGuire confronted that traveler this afternoon, and the traveler said to Wayne, "I'm not showing symptoms." He replied, "That's not something that stops the spread if you do have COVID-19. He called the police. This is what happened next.
I called the police right there at the scene when I took the pictures, and the police told me to call the health board. So I did. I left a message. They called me back in an hour, and I explained it to them, and they said, "Well, there's nothing we can do about it." And I just went, "What? Are you kidding me?" Tell that to the doctors and nurses on the front lines.
And meanwhile, we just had a protest about the Transit Windsor suspension. Bus service here has been suspended for 2 weeks. That's something that we've been following closely. We have all these details on our website. And just a reminder for our local viewers, CBC Windsor will return to television at 6 o'clock on Monday. Dwight?
Sure, your viewers are happy to hear that. Have a safe weekend, sir. Thank you, Chris.
And I just can't stress how disappointed I am with President Trump.
Premier Ford had some harsh words for Donald Trump today. N95 masks at the center of a North American trade battle coming up next. A major U.S. manufacturer of medical masks says it's under pressure to stop exporting to Canada and other countries. 3M says the move by the Trump administration to stop exports would likely lead to other countries retaliating. Today, Prime Minister Trudeau had this to say.
The United States also receives essential supplies and products and indeed healthcare professionals from Canada every single day. I think of the thousands of nurses, for example, who cross the bridge in Windsor to work in the Detroit medical system every single day. These are things that Americans rely on, and it would be a mistake to create blockages or reduce the amount of back and forth trade of essential goods and services, including medical goods, across our border. That is the point we're making very clearly to the American administration right now.
Trudeau says he's confident that Canada will receive the equipment and that the government will do everything it can to ensure that no part of Canada goes without essential supplies. Now, Premier Doug Ford says he's got a couple of million N95 masks on order from 3M, so he's asking them what happens now. Ford says he has other sources for masks and hopes an Ontario manufacturer can also help. And he had this to say about Donald Trump.
I just can't stress how disappointed I am with President Trump for making this decision. I understand, he's thinking I got to take care of my own people, but we're connected. And but even in saying that, I'm not going to rely on President Trump. I'm not going to rely on any prime minister or president or any country ever again.
After the break, today's Frontline Hero. You'll want to stick around for that. Stay with us. We're coming right back. It is time for our Frontline Heroes segment. And when he's not caring for his parents, friends say Dr. Arnav Agarwal, he does research or he's advocating for those without access to health care. Dr. Agarwal is today's Frontline Hero, a daily segment where we give a shout out to someone making a difference on the front line. Here he is. Dr. Agarwal is an internal medicine resident physician at the University of Toronto. His friend and colleague, Samir Kushawa, wrote in to tell us about his efforts. He says the doctor's commitment to understanding the patients and doing everything he can to support them and their families is remarkable. Off the wards, Arnav has been immersed in over 10 years of outstanding clinical epidemiology research. Despite being only 27 years old, Agarwal is one of several health professionals who successfully fought to ensure uninsured Ontarians would have access to health care during this pandemic. We want to thank you for your efforts, Dr. Agarwal. So thank you for everything you're doing. If you'd like to share a story about your frontline hero, send us a selfie-style video explaining why they are a hero to you. You can email us at torontotips@cbc.ca, tag us on Twitter or Instagram at CBC Toronto, or send us a message on Facebook. And before we go, we want to update you on what's happening with this show on Monday. Starting on Monday, we will be back to a full hour of news for you. We want to thank you for sticking with us through the last 2 weeks of changes. We really appreciate it. That's our show for tonight. Thank you for joining us. We'll see you on Monday for a full hour. Power and Politics is coming up next.